I'm Dr. Maxwell Jen. I'm a board-certified obesity medicine doctor, and I practice weight management and anti-aging medicine. Today, we're going to be talking about Semaglutide. I get tons of questions from my patients about Semaglutide, and so hopefully this will help answer many of those questions. So first of all, what is Semaglutide used for? Semaglutide was originally developed as an anti-diabetes medication. It has properties that allow you to lower blood sugar if you have elevated blood sugar from diabetes. Later, they discovered it's like, oh, some of these patients who are suffering from diabetes and obesity are also losing weight on Semaglutide. So in recent years, Semaglutide has been adopted as an anti-weight or a weight loss medication. So what is the relationship between Semaglutide and Ozempic? Ozempic is a brand name for Semaglutide. Semaglutide is generic, Ozempic is the brand name. There are other brand names for Ozempic, like Wegovy, and that's all it is. The medication is exactly the same, it's just two different names for it. Is Semaglutide FDA approved for weight loss? A little bit of a complicated question. It depends on which brand of Semaglutide you're talking about. So the brand Ozempic, which is still Semaglutide, is not FDA approved for weight loss. But Wegovy, which is also Semaglutide, is a brand approved for weight loss. And the only difference is that Wegovy is generally sold and marketed at a different dose than Ozempic is. Why does Semaglutide help people lose weight? So there's a couple of different ways that Semaglutide works in the body that ultimately produces a weight loss effect. So the first one is that it slows gastric emptying. So the food stays in your stomach a little bit longer, allowing you to feel more full. That's how a lot of patients feel like they don't need a lot of food and they just have no appetite after that. It also seems to work in your brain to decrease cravings, and so therefore you crave food a little bit less. And last but not least, this actually comes from my friend. He believes that the nausea caused by Semaglutide is just so terrible feeling that the last thing you want to think about is food. So what is the dark side of Semaglutide? Okay, so there's actually a really large dark side to Semaglutide. So Semaglutide being one of the newer medications means that it still has a lot of patent protections behind it. So that means that the pharmaceutical companies can sell these drugs for a really high price and make lots and lots of money. And so they're marketing it really heavily, even for patients where Semaglutide may not be the most appropriate. It turns out that Semaglutide is really only supposed to be used for patients who are truly obese. There are some exceptions as well. If you're overweight and you have an obesity-related condition such as heart disease, it might be appropriate as well. But classically, it's for patients who are truly obese, not a little bit overweight. And the research shows that with Semaglutide, the obese patient will lose about 15% of total body weight over the course of a year. It's never really been well studied in patients who aren't obese. So it may not be entirely appropriate if you're just a little bit overweight and you're looking to lose a few pounds. The other part about Semaglutide is that once you start it, at least according to the obesity studies, you really can't stop. Because once you stop the Semaglutide, the weight generally comes flying back. And again, we don't really know what happens in patients who aren't obese, but we do notice that in patients who are obese, that they generally need to be on Semaglutide for life. More research to come, perhaps that will change with newer studies and newer protocols, but that's kind of what we notice right now. For patients who are using Semaglutide when they're not obese, we've already noticed a couple of unfortunate side effects and consequences. Aesthetically, there's something called Ozempic face, and that's where the patient loses weight so quickly that they start to lose fat even in places where you don't want to lose fat. So for instance, in females, you may not want to lose it in the breasts, in the butt, or of course also you don't want to really lose it in your lower face, because what will happen is you're going to start to lose that volume. You'll look hollowed out and kind of skeletal. So even though you're losing weight, you might actually look worse off because of it. Other side effects that we have noticed with Semaglutide is something called an ileus, which is where your intestines basically stop moving. So you remember how I said one of the mechanisms of how you lose weight is that it slows down gastric emptying, your stomach doesn't empty as quick? Well, taken to its extreme, your stomach and your intestines can stop completely, and now all of a sudden you have a life-threatening bowel obstruction, and you'll have to go to the ER, get emergency surgery, and have to have a surgical procedure called an ostomy. At our hospital, we're seeing probably about 1 Ozempic-related complication per week, if not even more. And we do expect that number to go up as more and more patients who should never be on semaglutide start using semaglutide. Do I recommend my patients use semaglutide? Well, the answer is it depends. So when I evaluate a patient, I actually consult with them for close to an hour, trying to understand where their weight problems are coming from. Is this something due to biology? Is it something related to stress or an emotional state? Is it a habit? Is it something else? And depending on all of those different factors, I decide whether or not semaglutide is appropriate for them, or perhaps even a different medication might be more appropriate and more effective for them. So you remember how I said that semaglutide, according to the literature, you can lose 15% of body weight in a year. For some patients, if we can get them diagnosed properly, they might lose 15% of body weight in as few as 3 to 6 months, depending on the patient. And so, from a time perspective, it might be a better use of that patient's time if I get them on the correct medication.